Good morning, everyone. We're still having a couple people trickle in, but we're going to go ahead and get started because we only have a quick hour here with Kaylin. So we have Kaylin Wells from the Georgia Early Education Alliance for Ready Students, GEARS. If you guys aren't familiar with it, go to gears.org. They always have some really great materials, especially if you're looking to get into early education policy or just things to help improve early infant mental health as well. So we have Kaylin. She is the senior policy analyst. Am I saying that correctly? I had to change my screens around. Right. And she is going to be talking about mental health parity, which is super important, and some new laws that have come up within our state. So I'm going to go ahead and turn it over.
Great. Thank you so much, Jill, and welcome everyone. I am going to go ahead and be upfront that today's session is going to be a little bit dense because we are talking about legislation, which is long and thorough. So bear with me and feel free to really take advantage of the question section or the chat box for questions, and I will try to get to them. So I am going to go ahead and introduce myself. My name is Kaylin Wells. I am the Senior Health Policy Manager at GEARS. We are a research, policy, and advocacy organization that focuses on the early childhood period, so issues that affect children from birth to 5. I would be joined by my colleague Ann Mukherjee at Georgia State today, but unfortunately she is out sick. So I will be handling her slides and will do my best. I can't promise to do as great of a job as Anne, but I will try my best. So if you could go to the next slide. So I want to get started with a poll. And this is really to gauge your kind of familiarity with the Mental Health Parity Act, which was passed last legislative session. So if in the chat you could put your name, where you're from, so your organization, and then answer this question. So how familiar are you with the Mental Health Parity Act? Not very familiar, somewhat familiar, very familiar. And that can just give me kind of a background on how deep to go. Okay, so I'm seeing some not very familiar and somewhat familiar. So just, that's great. But these are just flying in, great. Okay, so a lot of not very familiar. So I'll try to be as thorough as possible. But again, feel free to drop questions in the chat and then take advantage of that question section at the end. Next slide. So today we are going to do an overview of the Mental Health Parity Act and then talk about the overlap between the Mental Health Parity Act and the Child Abuse and Neglect Prevention Plan. So we will go through those 6 main parts and really get in the weeds around where this pertains to children. Just as kind of a brief overview, the Mental Health Parity Act was signed into law last spring by the governor. It was introduced in the House by the Speaker of the House, David Ralston, who doesn't introduce a lot of legislation. So that shows you kind of how important this was to the legislature. It was sort of carried through the House by Representative Todd Jones and Representative Mary Margaret Oliver. That is a bipartisan group who really carried this through with the support of advocates as well as other members of the House of Representatives. It then moved into the Senate where it underwent some revisions before finally being passed and then being signed into law. Next slide. So I wanted to put here some useful acronyms. We use a lot of acronyms in our work. I think all of you are familiar with this, but I wanted to put these acronyms here for you to reference when you have the slides later. I will try to explain every acronym that appears, but I wanted these to, be present for you should you need them later on. I want to draw your attention specifically to the BHCC and the BHRIC, the Behavioral Health Coordinating Council and the Behavioral Health Reform and Innovation Commission. These are two bodies that we're going to talk a lot about later on, as well as, of course, DBHDD is playing a really big role in the implementation of this act. So the DBHDD is the Georgia Department of Behavioral Health and Developmental Disabilities. Next slide. So now we're going to move into an overview of the Mental Health Parity Act. And this is where we're going to get a little bit wonky on the policy side. So again, I'm going to go slow. I'm going to try to talk through some of these things, but feel free to use that chat function for questions. Next slide. So the Mental Health Parity Act is broken out into 6 parts. The bill itself is 76 pages. The final bill is 76 pages. I think initially it was like close to 85 pages. It establishes new reports to ensure progress. So there is sort of an evaluation metric around, or an enforcement metric around providing these reports to ensure that implementation is happening. It also establishes new programs and new coordination efforts. So this is something that I think you'll hear a lot about throughout this bill, is really emphasizing coordination between state agencies who are working in the mental and behavioral health space to really ensure that individuals, families, children who are receiving mental health services are kind of getting, there's data sharing, there's coordination on the side of different state agencies and different stakeholders. In addition to the bill, last session, we saw funding for implementation of this bill's provisions. I believe it was about $180 million in the state budget to really focus on the implementation of the Mental Health Parity Act. So, this is not just a bill that comes without funding, which is really important because we know that it is going to take funding to carry out the bill's provisions. Next slide. So I mentioned that the Mental Health Parity Act is broken out into different sections. So the first section is really the namesake of the bill, and it's about 1/3 of the bill's content, and that is parity. So we're going to talk more about what parity means, but that's the first section. The second section focuses on workforce and system development. The third section on involuntary commitment. The fourth section on mental health courts and corrections. The fifth section on child and adolescent behavioral health. And then the sixth section on the Behavioral Health Reform and Innovation Commission. And then the seventh section is kind of standard for any legislation, and it basically repeals any laws that are conflicting with the Mental Health Parity Act. So we're going to focus on those first 6 sections really, and that 7th section is just standard for any legislation. Next slide. So the first section of the bill, which as I said represents about 1/3 of the bill's content, is focused on mental health parity. And what that means is that services related to mental health needs are treated the same as services related to physical health needs. So I think this is something that all of us can agree is, something that will help support access to mental health services in the state of Georgia. This aligns us with federal legislation called the Mental Health Parity and Addiction Equity Act, which was passed during the Obama administration. It updates and aligns definitions in Georgia law on mental health, substance use disorder, and coverage of these conditions. It establishes requirements for health insurers and CMOs to report on compliance with the Act. And so CMOs are care management organizations, which are essentially health insurance organizations that contract with Medicaid to provide services. So when we talk about CMOs, we're talking about Medicaid for children and families. And then it establishes mechanisms for consumers to submit complaints on non-compliance with parity. So that means that if a CMO or a health insurer does not cover a service, a mental health service, in the same way that they cover a physical health service, then consumers have more of a mechanism to submit a complaint. And we're going to go into a little bit more detail about that. The kind of time frame around this is that starting January 1st of 2023, these reports will start being submitted to these different commissioners. So the commissioners of the Department of Insurance and the Department of Community Health, which oversees Medicaid. There will also be, ongoing reports to the governor and the legislature by August 2023, and then annually thereafter. And the complaint system that I mentioned is supposed to be in place by January of 2023. So the next section is about workforce development. So anybody who works with children and families in the mental health space, I believe, is familiar with the fact that we have we don't have enough clinicians to serve the number of children and families in our state. So recognizing that, this bill put into place provisions to help support growing that workforce. And so they did that in two ways. The first is establishing service cancelable loans for behavioral health work, for the behavioral health workforce. So that means, if you incur loans during your higher education in pursuit of becoming a behavioral health practitioner, that with certain years of service, those loans would be canceled. The second is by establishing a database of behavioral health providers. And this is really important because right now we don't have the same understanding of what behavioral health providers are, working in the state of Georgia, who they are, where they're working, and then kind of more specifics about, who they're serving. Are they accepting Medicaid? Which types of health insurance are they accepting? Are they taking new clients? So this will establish this, this minimum data set survey, MDSS, that will really go into depth about what is available, what our landscape looks like here in Georgia. And that will inform ongoing efforts to help grow the workforce. And I see the question about loan forgiveness, Tanika, and we're going to go we're going to talk about the service cancelable loans a little bit more. And we're also going to go into more detail about the database. And Beverly, I'm going to address your question very specifically. Next slide. Okay, the next section is about involuntary commitment, and this requires DBHDD to establish a grant program to create assisted outpatient treatment programs in the state, and outline circumstances and procedures in which a peace officer can transport persons in need of mental health or substance use treatment to an emergency facility. We're not going to go into too much detail about this because this largely involves programs for the adult population. So we're not going to go into too much detail about that today, since we are focused on children. The next section is on mental health courts and corrections. This incorporates behavioral health co-responders into several parts of Georgia's public safety statutes and calls for 5 new co-responder programs. This outlines topics for explorations of the Behavioral Health Reform and Innovation Commission's Mental Health Courts and Corrections Subcommittee, outlines roles and responsibilities for the Office of Health Strategy and Coordination, and outlines new members to be added to the Behavioral Health Coordinating Council and new responsibilities for that council. So this slide mentions the Behavioral Health Reform and Innovation Commission, the Office of Health Strategy and Coordination, and the Behavioral Health Coordinating Council. And that's 3 bodies that are discussed in detail in this legislation. And so we are going to go into a little bit more detail about, what those kind of governing bodies do, who is represented, and sort of what role they play in children's and in access to children's mental health services. But I'm not going to go into too much detail about the co-responders, because again, that affects the adult population. And so we are focusing today on children. The next section, section 5, is related to child and adolescent behavioral health. And again, this section of the bill really focuses a lot on those governing bodies and sort of ensuring adequate representation of child serving state agencies, experts in children's mental health on those bodies. This also establishes the multi-agency treatment for children team. That acronym is MATCH. And we're going to talk more about the MATCH team a little bit later. It adds language about children and adults regarding the populations that CSBs serve. CSBs are community service boards. We're going to talk a little bit about that. And then again, sets an October 2024 deadline for creating a data sharing system relating to care and protection of children. So we are going to talk about that, but that essentially creates data sharing between the child serving state agencies to better coordinate around the care of children who are in need of services. And then the sixth section is on the Behavioral Health Reform and Innovation Commission. So the Behavioral Health Reform and Innovation Commission was established a few years ago to really have intense focus on behavioral health reform in the legislature. So the members of the Behavioral Health Reform and Innovation Commission really represent a wide array of professionals who are focused on mental health services, as well as members of the court system, legislators, just thinking through who else is on it, the former behavioral DBHDD commissioner. So there's a lot of sort of experts in this field who are on the Behavioral Health Reform and Innovation Commission. And this legislation continues the length of the Behavioral Health Reform and Innovation Commission's kind of tenure. So they will, extends their work through June of 2025. Next slide. So we've kind of reviewed the sections of the Mental Health Parity Act. And now we're going to take a look at how this bill aligns with the Child Abuse and Neglect Prevention Plan. Next slide. So as a reminder, the Child Abuse and Neglect Prevention Plan was established by working with local leaders to identify the greatest needs across Georgia to help protect children, help support families, and really have a vision for what well-being looks like in our state. Next slide. The Child Abuse and Neglect Prevention Plan really comes, has these different objectives. And there are a couple of objectives where there's significant overlap with the Mental Health Parity Act, and where the Mental Health Parity Act is going to help move forward some of these objectives in the Child Abuse and Neglect Prevention Plan. And I may call the Child Abuse and Neglect Prevention Plan the CANPP, because that is, that's sort of the short acronym. So the first objective that we're going to talk about is increasing family resiliency. And there are two sections here that have these overlap. The first is that promoting and expanding comprehensive and specialized supports for families of children with disabilities. And the Mental Health Parity Act instructs DBHDD to establish programs designed to serve infants, children, and youth with disabilities, cooperating with these other child-serving state agencies. The second is to promote, link, and support information and referral systems. So the first provision in the bill that really addresses that is that multi-agency treatment for children, or MATCH team. And to go into a little bit more detail about the MATCH team, the MATCH team will have representatives from DFACS, DJJ, DCAL, DPH, DOE, the Office of the Child Advocate, and the Department of Corrections to facilitate collaboration across these state agencies for children with very complex needs. So a lot of you have heard specifically about children who are being housed in hotels rather than in a foster, with a foster family. And so I think the intention behind this was to really be able to have these high-level representatives who can take cases with really complex needs and really find solutions for those children. So it's a really intentional approach to trying to find solutions for these specific children with really high needs. And the MATCH team will accept referrals from local interagency children's committees. The second is to create a statewide system for sharing data related to the care and protection of children across all of these child-serving state agencies. So we talked a little bit about this earlier, but this data sharing has been something that the state has been thinking about for a long time to really support collaboration and coordination for children who are in need of these kind of intensive services, so that, children aren't being missed if a child is being served, for example, by Babies Can't Wait, as well as, they are receiving services from DFACS or from DBHDD. The state agencies will be able to see that this child is receiving services, and they'll be able to coordinate and collaborate to better serve that child. Next slide. So I'm gonna really draw your attention to the second bullet here under increasing access to low or no cost community-based behavioral health services, which is a CANPP objective. Let me back up for a second. The second CANPP objective that we're going to talk a lot more about is increasing family mental health, which is part of the Child Abuse and Neglect Prevention Plan. And of course, the Mental Health Parity Act has a lot of overlap with this objective. I'm not going to go into every single piece of this slide because some of the pieces of this slide are pretty self-explanatory, but I want to talk about that second bullet under increased access to low or no cost community-based behavioral health services. And that first bullet says, compels the CMOs to comply with a minimum 85% medical loss ratio or such higher minimum percentage as may be set out in a contract between DCH and a CMO. So that is not as self-explanatory. There's a lot of acronyms there. There's that phrase medical loss ratio, which I had not heard before this bill. So I want to talk about that. So first, again, a CMO is a care management organization, and they contract with DCH to provide Medicaid services. And right now we have 3 CMOs in the state: Peach State, CareSource, and AmeriGroup. AmeriGroup is providing services for every child in foster care. And what this says is that when those CMOs contract with the state, they have to provide at least 85%, they have to spend at least 85% of their profits on services. So this is establishing kind of a minimum, and then a CMO could go above and beyond that and spend more. And so this basically compels the CMOs to provide additional services for children, as well as to do more spending in the community to help support sort of the community aspects of health for children. So one of the legislators called this a medical spend ratio rather than a medical loss ratio, because this really is about spending more on providing services for children and families. So I know that's a little bit confusing and a little deep in the Medicaid space, but kind of the key takeaway there is that these CMOs will be spending more on children and families, and they will be spending more in the communities. Next slide. So I saw a question in the chat about the service cancelable loans, and this is kind of an overlap with this specific part of the CANPP to promote evidence-based behavioral health training, assessment, and treatment models for all ages. So the goal of these service cancelable loans is to increase the number of mental health clinicians in the state of Georgia as a whole. So these service cancelable loans are for a range of professionals who are working in a range of different aspects of the kind of mental health services array. And we can expect to see more legislation on the service cancelable loans this session, because I think the bill, there's still some work to do to sort of clean up and ensure that the service cancelable loans provision is something that can be carried out by the state. So we will probably see more legislation this session. Then the other part of this that overlaps is that minimum data set survey, the behavioral health workforce database. And this is an opportunity, we're going to talk about this a little bit more later too, but this is an opportunity for all of us to do some advocacy around ensuring that what information is collected is useful to all of us who are working with children or working on workforce development initiatives, so that we can inform what is collected in that database. And so for Jill mentioned that GEARS does a lot of work on infant and early childhood mental health. And so one of the things that I'll be advocating for is that we are breaking out what ages are served by age range. So 0 to 3, 3 to 5, 5 to 11, but really ensuring that we have an understanding of what age ranges are being served. There will also be questions about, is this clinician accepting new patients? What types of insurance are accepted, including Medicaid and Medicare? So that minimum data set survey provides an opportunity for advocacy. So that's what I want to draw your attention to there. And then the last section there, the last bullet there is around establishing and supporting programs for the training of professional and technical personnel. So that will have DBHDD sort of establishing these, training initiatives. Next slide. So the next kind of provision of the child abuse and neglect prevention plan that we're going to talk about is promoting policies and approaches to ensure medical co-payments and the authorization of services by insurance companies are not barriers to mental health treatment. And, the Mental Health Parity Act does a lot to address this by really focusing on parity. So again, I said this before, but what that means is that mental health services cannot be more expensive than physical health services just because they're mental health services. So if a copay for, a gastroenterologist is $50, a copay for a mental health therapist will also be $50. An insurance plan cannot charge $70 for a mental health treatment just because it's a mental health treatment. So this is going a long way to ensure that those co-payments are not barriers to mental health treatments or other cost sharing mechanisms within health insurance. The other thing that it does is it does away with any prohibitions on same-day reimbursement. So if a patient comes in and has, they see a mental health provider and they see their primary care provider on the same day, they can, both of those providers can be reimbursed for those visits. And this is really important, especially for, our rural areas where a lot of times, folks will line up their appointments for the same day because they're traveling, 45 minutes, an hour to see their doctors. So this is really important and reduces, the burden on families. Again, there are more, the last two bullet points are about the rights of consumers whose services are denied reimbursement. So, if somebody receives, mental health services and those services are denied, this gives the consumer more of a right to appeal that decision, as well as if there is a parity violation, so they're charged more for a mental health service than a physical health service, they have more of a right, and there is a mechanism in place to appeal those denials. So that's, again, more rights for the consumers. And sorry, I can't keep up with the chats in real time, but we're going to have a section for questions. Okay, next slide. So this is, again, a focus on these kind of specialty and accountability courts, which I'm not going to go into too much detail on because, again, these are more for the adult population. But the last one that I wanted to point to is that provision. It instructs the Mental Health Parity Act instructs the Criminal Justice Coordinating Council to establish a grant program for the provision of funds to accountability courts that serve the mental health and co-occurring substance use disorder population to facilitate the implementation of trauma-informed treatment. And this is something that I know a lot of us who are in the child mental health space is really focused on, is really having more trauma-informed spaces as children and families are encountering these different systems, like the court systems, that there is sort of a trauma-informed lens in which families are being viewed. So that's a provision that really has significant overlap and implications for the CANPP. Okay, and then the last section is around social norms about mental health and how to recognize and seek help for mental illness and substance use disorder. And so this provision is one of my favorites. This instructs DBHDD to plan for and implement the coordination of mental health services with physical health services to ensure that these providers of primary and specialty care are coordinating. And this is really recognizing that the treatment of conditions of the brain and body should be integrated to promote recovery, health, and well-being. So this really focuses on integrating mental health services into these sort of more traditional medical settings and for more coordination between these different providers. So, you know, a clinician who, a family who, for example, gets a really scary medical diagnosis, the understanding is that that family needs mental health services too, and that these families can really, these providers can really collaborate to provide this more holistic care for children and families as well as adults. So that's one of my favorite provisions in this bill. So I'm going to pause here. Next slide. To have some questions. So if you click,
You want me to go back through the chat, Kellen? I can help you out.
Oh yeah.
We just had a couple. They want to know if MATCH is the same as MDT, so multidisciplinary team.
I know that there was a MATCH kind of similar governing body in the past, but I'm not as familiar. I don't know if it's the same, Bonita, but I can try to look into that for you.
And then Betty was asking, will there be more facilities like Laurel Heights and Hillside, which are always overcrowded and have to release children prematurely, and also due to Mayor Group not paying after a certain period?
So I think that provisions of this bill are focused on trying to relieve some of the pressure on facilities like Laurel Heights and Hillsides in a number of ways. One of those ways is growing the number of clinicians who are able to, who are behavioral health clinicians, because that's one of our concerns here is not just that we don't have enough facilities, but that we don't have enough of a workforce to staff facilities. The other is around that medical loss ratio. So it is about incentivizing or compelling the CMOs like AmeriGroup to spend more on care for children and families. And then there are, a number of provisions in the bill around parity. So reimbursement rates should be on par with physical health. So there's kind of a layered approach to how we can grow the number of facilities that are available to support children and families, rather than just a direct provision of like, we should have more beds. There's also a focus, I think more broadly, the idea is that the focus is on being able to build up some of the more preventative services so that we're not getting to in these kind of long-term facilities. So I would say it's a layered approach. And this question about 2 mental health services provided on the same day, however, like medical management and psychotherapy. Mary, I would have to go back and look at that specifically to answer that question. I don't want to, I have an idea of what the answer is, but I don't want to say the wrong thing. So if you want to put your email or email Jill, I can reach out to you with that answer or have it in a follow-up email. But with these kinds of 76-page bills, I don't want to give the wrong answer.
Did you already
Jill,
get to the loan forgiveness from Tanika? Because I know you said you were going to get to it, but I missed.
Yeah, we talked about the loan forgiveness, that there are a
And
number
then,
of different areas where you can serve to receive loan forgiveness. And I believe that that has been expanded as a result of this bill. Okay. And again, these are changes to what is currently being done. So you may see changes over the course of the next year to like, it won't be the same as it has been. So it's exciting. And also our communities, all of you who are providing these services, can play a role in identifying when some of the provisions are not being carried out properly, and being, filing reports with the Department of Insurance or the Department of Community Health to ensure that these provisions are being carried out. Will there be need for more legislation and regulatory guidelines on things like data sharing so the insurance commissioner can enforce? Yes, April, we're going to see more legislation for sure related to this, to kind of clean up, to add teeth, as they say, to some of these provisions, so that the provisions can be enforced. But I think we can expect to see additional legislation in the coming years. So Jill, if you click, I had some questions to kind of prompt conversation. Yeah. So if you could just in the chat, what are the parts of the law, as we've talked about, that you're most excited about or most confident will help the behavioral health system? What parts of the law are you most hesitant or cautious about? How they will impact your role or Georgia systems? And then what structural or systems changes could have the most impact on your work? I know that's a lot. So while you're thinking up your answers, I'm going to go through the next few slides and then we can come back and sort of talk about those.
yeah, so if you just want to put like excited and then hesitant and then impactful. So
Yeah.
those three things.
Okay, so I just want to really quickly dive a little deeper into that collaboration section, because I think that this is really going to be something that a lot of you are going to start kind of interacting with. So the three, next slide, the three key groups that have new roles and responsibilities to facilitate collaboration. We're going to talk about those, and then we're going to go into a little bit more detail about match. So next slide. The first is the Office of Health Strategy and Coordination, and this was an existing office within the governor's office that provides coordination support across state agencies. But the Mental Health Parity Act outlined new roles for this office and identified new state agencies for it to collaborate with. And, one of those agencies, for example, is the Department of Early Care and Learning, which wasn't previously listed there. And so, this is really important to a lot of us who work with young children to have DECAL at the table to really be able to kind of provide that perspective. The second is the Behavioral Health Reform and Innovation Commission, which I talked about. This was created in 2019. This extends the work of the commission until 2025 and adds new members. And then the last is the Behavioral Health Coordinating Council, which was established in 2009. The Interagency Directors Team is a work group of this council. And again, the Mental Health Parity Act adds new members and responsibilities to the council. And again, of relevance to this group, for both the BHRIC and the BHCC, the commissioner of DECAL a child advocate, an expert on early childhood mental health, an expert on child and adolescent mental health, and a pediatrician were added to the BHRIC and BHCC. So there will be more representatives who are focused on children's mental health. Next slide. So the match team, again, is, we're gonna have some opportunities here to kind of see how this pans out and what this really looks like, and potentially play a role as advocates to ensure that this is really helpful for children and families across the state. Next slide. So this section calls DBHDD to establish this match team. Next slide. And the roles and responsibilities of the match team are to facilitate collaboration across state agencies, to explore resources and solutions for complex and unmet treatment needs for children in the state, and to provide for solutions, including both public and private providers as necessary. So again, this is taking individual children with these really complex unmet needs and having all of the state agencies at the table to really look at how can we help this individual child. And so at the very highest level, there will be coordination around supporting this child. Next slide. The state match team will accept referrals from local interagency children's committees throughout Georgia for these specific cases. Next slide. The state agencies and entities represented on the state match team shall coordinate with each other and take all reasonable steps necessary to provide for collaboration and coordination. Next slide. And then these are the agencies that are represented in on the match team. So that was a lot. It's a very long bill, as I mentioned. And I think we, next slide, Jill. We have a lot of opportunities here to really think about how this is implemented and really play a role in, thinking about the enforcement of the specific provisions, holding our leaders accountable to ensure that they are being implemented in a way that is that's working for all of you who are affected by the provisions of this bill. And so if you, next slide, if you see that the implementation is not, working, I think it's really important to make your voice heard and really speak up and say, my understanding of this bill is that we would have parity between mental health services and physical health services. And I'm not seeing that when I am serving, children and families across the state. And so letting advocates like myself know that that's happening, so we can kind of talk about, different mechanisms to ensure that the implementation is working for Georgia.
So it looks like, sorry to interrupt, we have a lot of people on here that this is directly impacting.
Yes.
Or kind of on the front line. So would you recommend them kind of following gears and getting contact information then? I think Georgians for a Healthy Future are probably looking at this as well. Are there any other entities that they can reach out to? Because it's hard as an individual. Where do you go to advocate directly if you don't have that foot in the door?
Yeah, so Georgians for a Healthy Future is a great organization, as is NAMI Georgia. The Georgia Council for Substance Abuse, I believe is the full name. But NAMI Georgia is a really good organization to reach out to when you do see Parity Act violations. I will put the information to connect with NAMI, or I'll put their website in the chat so that y'all can really reach out to them, because they have been really influential in bringing this act to fruition. And
I just got it in the chat, so
great,
people can go in the chat right now.
Yeah.
Awesome. Yeah, so they have a couple of them, and then there's Garrett's as well.
Yes, thank you, Jill. So I just want to go back through. Jill, how are we doing on time?
We have 10 more minutes.
Okay, so we have time for questions, or if anybody wants to maybe unmute and say what they're excited about, or what they're, kind of nervous about, or what they think will be the most impactful. We do have those in the chat, so I could read them out, but I would love to hear from someone if anyone wants to come off mute and talk about what their thoughts are. I see a lot of folks are saying that they're excited about the data sharing. So that's, I think the broader emphasis on collaboration and coordination between different entities is something that a lot of children's mental health advocates have been really looking for a long time. And it sounds like that's something that all of you are echoing. Yeah, and Brenda, I see most parents I deal with have trouble getting enrolled and understanding the system. I wish there were more transparency and user-friendly databases. Definitely. We see this a lot with Medicaid enrollment, that it's really difficult to enroll in Medicaid and to stay on Medicaid through those renewals. So even just getting Medicaid is complicated, and then actually finding a provider who takes Medicaid, having especially one that takes Medicaid for, let's say, a child under the age of 5 or a child with co-occurring diagnoses, there's it gets really complicated. And so, I think this bill, one of the provision around the behavioral health workforce database is kind of a first step in seeing what's available and sort of where our gaps are, and just having a better understanding of where people are, who they're seeing. And I believe the hope eventually is that would be something that could be used both for, policy efforts, and also at some point be something that families could use. I'm seeing the behavioral mental health and primary care integration as impactful. That's definitely something that I was excited to see in the bill as well. The ability to bill more than one service on the same day, because Courtney's saying that they couldn't do individual and family sessions in the same day, which is ridiculous. I agree. That's a really important thing, especially again, when we're serving children, because children exist in the context of their families. And, families need those services too. So, yeah, I see Jordan talking about having more licensed therapists in the school. And we are seeing, from the campaign trail, both candidates talking about this specific issue of having more mental health services available in schools. So we already have, we're already actually national leaders with our APEX program. But I think that there's an understanding that really needs to grow. Maggie, I see that you are hesitant about confidentiality and data sharing. And I think this is really important to bring up, because this has been a concern that a lot of advocates voiced. And I just want to step back for a second and say, when I say advocates, I don't just mean, me, who is like a registered lobbyist. I mean, citizen advocates and, clinicians and doctors who are advocates in their own right, because advocate is a really is a really broad term, right? It's a big umbrella term. And so I would argue that all of you, just by joining and by kind of voicing your hesitation or your excitement about something, you're advocating, you are playing a role in advocacy. So again, reinforcing that all of you are advocates and have a role to play in this, in the implementation of this. Brenda, I see your question about our parents also at the table. And I think this is really important and something that CARES advocates for really regularly, that there isn't, there aren't always parents at the table. And so that's something that we continuously advocate for in our work. Sorry, I'm just reading through some of these comments. Yes, I see you, Fozia. I was like, did Fozia write this? Fozia wrote about permitting primary care physicians to access and, bill and receive adequate reimbursement for mental behavioral health services, so that, as, for example, a child is in their pediatrician's office, they can receive services right then. So that's really important.
Would it be helpful if I read the other ones?
Yeah,
I'm
trying to like read through them.
Yeah, sorry. So we have Beverly saying, how close are they to creating the service database, especially for young children? Getting parents assistance in dealing with children out of control is really difficult.
Yeah, so the minimum data set survey will be, probably another year or more away from really being in a position where it's robust. But in the meantime, you can go to, I love this question, and this is my area of expertise. So you can go to georgiaaim.org. I put the link in the chat, and reach out there, or you can reach out to me directly, because we are working really hard on creating a database specifically for very young children who have experienced trauma or who are showing early signs of mental health challenges. And this is, of course, dyadic therapies. So the caregiver and the child are always seen together, and the focus is really on that caregiver relationship, because we know that's really where, we find where children find resilience and healing. And so Georgia AIM is the Georgia Association for Infant Mental Health. It's a brand new organization. It's actually housed at Georgia State University in the Center for Leadership and Disability, and will really serve as kind of the hub for early childhood mental health services, and as a support for a broad range of professionals who are serving young children. So not just mental health clinicians, but also early childhood educators, home visitors, other folks who are involved with young children to ensure that they have what they need to support children who've experienced trauma, because Beverly, that definitely, it's very real. And when we can address it right after it happens, or, work on that relationship so that children really have, that supportive caregiving relationship, that's how we, prevent future mental health challenges. So that's something that we've been working really hard on. And so I appreciate you bringing it up.
And we have time. We have 1 minute for one question. And I think this is a good closing question. As organizations involved with the mental health services, do you have any recommendations as how we as a group can make sure mental health stays at the forefront of our state legislature? With advocate locally with our state legislator, or should we be doing more?
Yeah, so I mean, The best way to bring this up is to reach out directly to your legislators. You can look up who your legislators are and start a relationship with them. Maybe send them an email and say, hi, I am doing this work in your region, in your district, and this is really important for me. And I really hope that this will continue to be something that you think about as you go into next session, and also offer your own expertise because you all are the experts. Legislators are jacks of all trades. They have to know a little bit about a lot, and they really rely on their constituents who have expertise to help guide them. And so you really have an opportunity to be the expert in your legislator's district and say, this is what I really think would help me as a clinician. This is what I really think would help children in your district who are experiencing mental health challenges. So you can really serve as an expert. And Jill put my email in, but I'm adding it again. If you ever want to go to the Capitol and have a tour or, just kind of get the lay of the land so that you can be there and be an advocate. Sometimes the Capitol is really scary. It's a really big building. There's a lot of people with name tags walking around who look like they have somewhere really important to be. And sometimes just kind of touring it and kind of getting getting your feet wet there, it can really kind of take away the fear of going into that space and advocating. And I'm happy to help you tour that space. The other piece is to get involved with NAMI. NAMI Georgia does a lot of advocacy. GEARS does a lot of advocacy around infant and early childhood mental health. So getting to know the different organizations who are doing legislative advocacy, because we also really need your expertise and want to lift up your voices, because we have our understandings of what's going on, but we always are informing ourselves with folks who are in the field. That's really critical to our work. So we can be a messenger for you because a lot of you obviously can't go to the Capitol every day. You're serving children. So we can play that role for you as well. Voices for Georgia's Children is also another organization. Jill, if you could put their link in the chat. They are another advocacy organization.
Really quick. I would recommend, so to even know when it's time to go advocate or time to go look at those things or when things are popping up, it's super hard to be attuned to all that all the time. As Kelly mentioned, this is a really long document. You don't have time to spill over that. Following GEARS newsletter, Voices for Georgia's Children, NAMI, their newsletters, and they often will send out quick action things that you can take on them so you know when to prompt when a vote is coming up to contact your legislator. So I would definitely recommend signing up for all of their newsletters. I'll put Georgia Voices on the conference website. That is all the time we have for. Quickly go copy paste Callan's email address right there. That was a super generous offer of her to take you around for that big learning curve. So thank you so much, Callan, for spending the time on this to help everyone understand what's going on in state so we can lift our voices up and advocate, especially all these direct service providers are super important to getting that message across. So thank you, everyone. Go back to the Cadence platform for a resource hour, and then again at 1 to tune in for the keynote. Have a good one. Thank you.